All right, now we're talking about section 6 of chapter 13 on the brain and cranial nerves, with the cerebellum. After going through this section, you should be able to name the parts and the landmarks of the cerebellum, identify the 3 tracks through which the brainstem is linked to the cerebellum, and explain the functions of the cerebellum. The cerebellum is the second largest brain area after the cerebrum. The cerebral cortex is convoluted surface with folia, or folds, the left and right, and contains the left and right cerebellar hemispheres. Each hemisphere has an anterior and a posterior lobe that's separated by a primary fissure. And there's the vermis, which is the narrow band of the cortex between the left and the right lobes. It receives sensory signals regarding the torso and balance. And 3 regions of the cerebellum are the cerebellar cortex, outer gray matter, the arbor vitae, which is the internal region of white matter, and the deep cerebellar nuclei of the gray matter. 3 thick nerve tracts which connect the cerebellum to the brainstem are the superior cerebellar peduncles, which connect the cerebellum to the midbrain, the middle cerebellar peduncles, which are connecting the cerebellum to the pons, and the inferior cerebellar peduncles, which connect the cerebellum to medulla oblongata. So here we have, in our image, our she's showing here, of course, our cerebellum, okay? And as part of that cerebellum, we include here our cerebral aqueduct here, our tactile plate, our midbrain. The cerebellum may actually be the back portion here, of course, here. Their 4th ventricle here, pons, medulla oblongata, and it being the cerebellum here, the cerebellar cortex, and the folia, the arbor vitae, the white matter, okay? And the cerebellar hemisphere, looking at the anterior and the posterior, looking at it from a superior view here. The vermis down the middle here, the cerebellar hemisphere, the anterior lobe, and the posterior lobes, okay? And the primary fissure, right through here, separating the anterior and the posterior lobes, and of course the folia. And I should have noted here, of course, referring to the basically the pons, the medulla oblongata, as opposed to the cerebellum here, being that region here, the bottom there. For the functions of the cerebellum coordinates and fine-tunes movements and ensures muscle activity follows the correct pattern. It stores memories of previously learned movements. It regulates activity along the voluntary and involuntary motor paths. It adjusts movements initiated by the cerebrum, ensuring smoothness. It helps maintain equilibrium and posture. It receives proprioceptive information from the muscles of the joints. It continuously receives motor plans and sensory feedback. It may generate error-correcting signals to be sent to the premotor and primary motor cortex. So our cerebellar pathways here for involuntary movements with actually efferent information sent back to the muscles, primary motor cortex, the basal nuclei, and the forebrain send impulses through the nuclei of the pons to the cerebellum and then out to the body from there. And of course, blue here denotes coming to the cerebellum information, proprioceptors and skeletal muscles and joints report degree of movement to the cerebellum. The green here, integration and analysis within the cerebellum. The cerebellum compares the planned movements, the motor signals, against the results of the actual movements, the sensory signals. And then the corrective feedback, get information here, going to the brain, and of course it'll then come back to be sent out as efferent information to the body. The cerebellum sends impulses to through the thalamus to the primary motor cortex and to the motor nuclei in the brainstem before it's integrated and then sent back to the body. For a clinical perspective, the effects of alcohol and drugs in the cerebellum, and again, this is something not going to be tested on, but something that's certainly good to know for now, but more important for later. A variety of drugs can impair cerebellar function. That includes alcohol. Symptoms are disturbance of gait, inability to walk properly, loss of balance and posture, and inability to detect proprioceptive information. So 13.6, what did you learn? What are the primary anatomic components of the cerebellum? The middle cerebellar peduncles connect the cerebellum to which part of the brainstem? And what are the functions of the cerebellum? For the functional brain systems, for the some functions we should be able to understand, or objectives should be able to understand going forward here, are describe the main functions of the limbic system, list the 7 structures that compose the limbic system, and summarize their actions. Describe the components and function of the reticular formation, and explain anatomy and function of the reticular activating system, RAS. For the limbic system is the emotional brain. It's composed of multiple cerebral and diencephalic structures that process and experience emotions. The limbic system components includes a cingulate gyrus in the sagittal plane, which is above the corpus callosum, the parahippocampal gyrus, which is associated with the hippocampus. It's the cortical tissue and the temporal lobe. The hippocampus, which is superior to parahippocampal gyrus, the temporal lobe, helps form long-term memories. The amygdaloid body is involved in many aspects of emotion and emotional memory, especially fear. Olfactory bulbs, olfactory tracts, and olfactory cortex processes odors that can provoke, as opposed to processing odors, processes odors that can provoke emotions. The fornix is a thin white tract connecting the hippocampus with other limbic structures. Nuclei that interconnect to other parts of the limbic system include the anterior thalamic nuclei, habenular nuclei, septal nuclei, and the mammillary bodies. So here, you can see in looking at our limbic system, right? Our corpus callosum, our anterior commissure, it's a mid-sagittal section, our cingulate gyrus, our fornix, the anterior thalamic nucleus, our septal nucleus, mammillary body, and our hippocampus, amygdaloid body, parahippocampal gyrus, the olfactory tract here, and the olfactory bulb. For reticular formation, it's loosely organized gray matter of the brainstem. The motor component regulates muscle tone via spinal cord connections. It assists in autonomic functions through the brainstem connections. The sensory component is a reticular activating system. It processes sensory information, sends signals to the cortex to bring about alertness, like response to the sound of an alarm clock. Alertness helps bring about awareness of sensations, movements, thoughts, which is necessary for higher states, not just highest, but for the highest states of consciousness or higher states of consciousness. So the reticular formation, get the RAS output here coming to the cerebral cortex, visual nerve signals coming from the optic nerve from the eye, reticular formation coming also from below, being sent from basically from the spinal cord, auditory nerve signals coming from the ear, motor tracts sending information to the spinal cord, and of course general sensory tracts, touch, pain, and temperature reporting up to the brain, to the cerebrum. For clinical views, pathologic states of unconsciousness, some again would be good to know, important for later, vital for later, just not as much now. Feigning or brief loss of consciousness often signals inadequate cerebral blood flow due to low blood pressure. Stupor is arousable only to extreme stimuli. It accompanies some metabolic disorders, liver, kidney disease, brain trauma, or drug use. Coma is a deep and profound unconsciousness that's non-responsive. Of course, causes include severe head injury, metabolic failure, basically cardiovascular symptoms like stroke, very low blood sugar or strokes, and or drugs, I'm sorry, and persistent vegetative state, lack of thought and awareness, but non-cognitive brain functions continue. Some spontaneous movements are possible in that respect. So 13.7, what did you learn? What are the components of the limbic system? What are the main functions of the limbic system? And how is the reticular activating system related to the reticular formation? So we'll talk about the integrative functions and higher order brain functions now for section 13.8. You should be able to describe the relationship between age and higher order brain functioning. Describe how an electroencephalogram examines brain activity. Describe the main characteristics of sleep. Compare and contrast non-REM and REM sleep. Identify the brain areas in which cognition occurs. You should also be able to explain how lesions to different regions of the cortex affect cognition. Compare and contrast short-term and long-term memory, and describe the parts of the brain involved with each. You should be able to name the two regions of the limbic system that are involved in conversion of short-term memory to long-term memory. Explain the interactions of the prefrontal cortex and the limbic system in expression of emotions. List the cerebral centers involved in written and spoken language and describe how these centers work together. For integrative functions and our higher order brain functions. Those higher order mental functions include learning, memory, and reasoning. They occur within the cortex of the cerebrum. They involve multiple brain regions. Both are conscious and unconscious processing involved here. The CNS development for higher order brain functions, their processing abilities become complex with maturation. Most CNS axons are still myelinating during the first 2 years of life. Most of them are. Brain growth is rapid in early childhood, with 95% complete at age 5 from a standpoint of size of the brain itself. Beyond early childhood, processing is more complex and more refined. New connections are made while others are pruned, right? Which makes logical sense. Some CNS axons, especially the prefrontal cortex, are still undergoing myelination in adolescence. And the reality is myelination occurs throughout life. These are the primary times for myelination, of course. The earlier, the better. The more, the better. Both. Axons of the PNS continue to myelinate past puberty. The electroencephalogram EEG electrodes are attached to the head to record brain activity. They're used in studies of sleep, brain lesions, coma, vegetative state. They're used to evaluate epilepsy or repeated seizures. Seizures may involve blackouts like muscle spasms and shaking, including muscle spasms and shaking. Activity occurs with different frequencies designated by Greek letters. Alpha and beta waves are common in wakefulness, and delta and theta waves are common in sleep. Electrodes are placed over many spots in the head to examine the location of different types of brain activity with the EEG. So here you have an EEG. Someone's awake with mental activity with the beta is at 14 to 30 hertz here, frequency-wise, and it's slowing down, awake and resting, right? Sleeping slows down even more, right? And then deep sleep. See these undulations here, right? Less than 3.5 hertz. That's over the time. That's over a 1 second span. A lot less activity, obviously, from a standpoint of frequency. Sleep. Sleep is a natural temporary absence of consciousness. It's an interesting way. No one really talks about it that way from a general perspective, but it's technically true. Less cortical activity, vital brainstem functions are maintained. Sleep stages are characterized by EEG frequency and eye movements. Non-REM rapid eye movement sleep, there's slower frequency brain waves, takes about 75% of the total sleep time in most cases. It's not always true, but generally speaking. Important for growth, rest, energy conservation, and strength renewal. You got to have a lot of non-REM sleep. It's divided up into substages with different EEG frequencies, delta, theta, etc. Whereas REM, or rapid eye movement sleep, the brain's active and eyes move, takes about 25% of total sleep time. It can take up a lot more, in which case someone doesn't get restful sleep. Memorable dreaming occurs here. It's considered important for consolidation of memories. So here we have a hypnogram showing basically a time from showing awakening here and REM sleep, stage 1, stage 2, stage 3, stage 4, over time, as you see throughout the course of the day, the course of the night, and significant fluctuations in going from awake to REM sleep, and then deeper sleep, and coming back toward REM sleep and deeper sleep. Deeper sleep is not REM sleep. Deepest sleep is you don't recognize it. The best nights of sleep are the ones you go to sleep, and you wake up, and you feel fully rested, but you feel like you just went to sleep. Those are the best times, and they are very difficult to come by if someone's under a significant amount of stress. Sleep requirements change through lifespan. Infants need about 17 to 18 hours for an infant. Teens, 8.5 to 9.5 hours. And you could argue that some of these would be even higher for someone who has a high level of stress. Higher level of stress, whether it's physical stress, physiological stress, or mental stress, any kind of stress, these numbers go up, generally, for everyone. Adults, 7 to 8 hours. Lack of sleep is unhealthy. I can certainly speak to that because I don't get my 7 on a regular basis. It's associated with depression, poor memory, poor immune function. Let's be clear. A lot of people don't like to talk about depression, but from a general perspective, in a single 24-hour period, every single human being experiences some aspect of depression for a moment, or maybe multiple moments throughout the day. It's whether it pervades. And sleep is important to help avoid this, let alone numerous other factors. But getting proper sleep is monstrously important, if you didn't already know that. Insomnia is difficulty falling asleep or staying asleep. It's more common as we age, and it's more common in stress in general. But of course, it becomes more common as we age if we are not moving, if we're not getting enough of the right stress. Then we also have issues with insomnia. There's too much of the distress and not enough eustress, both, that play a role here. Sleep apnea is breathing interruptions during sleep, frequent awakenings, lack of sleep. It's happened to me far too often in the last several months. That being said, if it's a long-term thing, it's not just related to something going on at the short term. It can be treated with CPAP, continuous positive airway pressure mask, something to look into if someone can't solve it through other means, right? Cognition is the mental process of awareness, knowledge, memory, perception, and thinking. Association areas of the cerebrum are responsible. Studies of brain lesion patients help explain normal function. Frontal lobe patients with personality abnormalities to demonstrate frontal lobe's function in planning and decision making. Damage to the primary somatosensory cortex causes loss of body awareness on the opposite side. Agnosia is the inability to recognize or understand meaning of stimuli. Location of lesion determines the nature of the loss. Like an example is a temporal lobe lesion may lead to inability to recognize meaning of sound or words. Types of memory of our sensory memory. Associations are based on sensory input, like smell of coffee, that lasts for seconds. Short-term memory, STM, limited capacity, about 7 bits of information, like a phone number, right? Brief duration, seconds to hours. Long-term memory can be encoded from short-term memory if information is repeated. It may exist indefinitely, but can be lost if not retrieved occasionally. All the more reason why it's important to go back to information and review things in general, right? So we have our stimulus from our sensory organs, getting the perception, sensory memory, a millisecond to 1 second, then it's our attention. We get short-term memory, start forgetting here. If you don't get the repetition, and you're trying to get retrieval, goes to long-term memory with encoding for days, months, and years if you keep repeating it. Brain areas involved in memory and coding. Memory consolidation requires the amygdala and the hippocampus. And long-term memory is housed primarily in appropriate association cortex area. Motor memories are stored in the premotor cortex and the cerebellum, and memories of sounds are stored in the auditory association cortex. And from a clinical view, Alzheimer's disease, also known as the long goodbye, is the leading cause of dementia in the developed world. There's slow progressive loss of higher intellectual function, usually starts after age about 65, typically, changes in mood and behavior, eventual loss of memory and personality, underlying cause is unknown. The significance of beta amyloid plaques and tau tangles is debated. That's something we'll talk about probably more in later units, and certainly more in higher levels of just referring to neurological challenges. No cure. Some medications can help to slow the course. Some seems identifiable with positron emission tomography, the PET scan, be able to identify it. And loss of sense of smell may be an early sign of the disease, not be able to smell things. Amnesia is a partial, complete loss of memory. It's usually temporary, affects only a portion of experiences like psychological trauma, direct brain injury. The type and degree of recovery depends on the part of the brain that's damaged. Damage to the thalamus and limbic structures, especially hippocampus, disrupts and prevents formation of new memories. If you've ever seen the movie 50 First Dates with Drew Barrymore and Adam Sandler, that's actually a real disease whereby, I've got the name of it off the top of my head here, but it's basically an aspect of brain trauma whereby the person can not remember anything that happened before their brain trauma. I'm sorry, I can't recall information that happened, anything that happens after that brain trauma. Basically, they wake up, they remember everything before the trauma and nothing that happened after it. Emotion, the brain regions are involved in emotion. Emotions are interpreted by the limbic system, but their expression is controlled by the prefrontal cortex. The amygdaloid body and hippocampus are important structures. If they're damaged or artificially stimulated, emotions are deadened or exaggerated and learning is impaired. Our language involves reading, understanding, speaking, and writing words. The Wernicke area interprets that language, okay? And basically the motor speech, or the Broca area here, initiates speech motor program. There's the Wernicke area here, the central here, the angular gyrus here. Basically, we have the primary motor cortex signals motor neurons to produce speech. Okay? The categorical hemisphere, including the Wernicke area, analyzes the literal meaning of speech. Representational hemisphere analyzes the emotional content of speech. The lesion to the right hemisphere opposite the Wernicke area can cause a processia, which is a dull, emotionless speech. Which we've all heard someone do at some point or another, hopefully not a pervasive disease. It would be a very unfortunate problem for anyone. Apraxia of speech is a motor disorder. The person is aware of what they want to say but cannot speak properly. Aphasia is difficulty understanding or producing speech. May not produce comprehensible speech, may not realize it, and it's often due to head injury or stroke. Dyslexia is an inherited learning disability, problems with single word decoding. Individuals have trouble reading, writing, and spelling. Level of reading competence is below expected intelligence. Improvement in some individuals occurs with time. It may be a form of disconnect syndrome, which is an impaired transfer of information through the corpus callosum. So what did you learn? What are some implications of the brain's anatomic development not being complete until the mid-teens? An EEG may be used to evaluate what clinical conditions? What are the main differences between non-REM and REM sleep? During what percentage of our sleep cycle are we in each type of sleep? What's the definition of cognition? What types of study habits best convert short-term memories into long-term memories? What portions of the brain limbic system are involved with modulation of emotion? How is the Wernicke area involved in language processing? I'll come back for our final sections here with the cranial nerves coming up shortly.